So I had spoken about this at the start of the show. Today marks World Diabetes Day, which is a day set aside to shine the spotlight on the need to pursue efforts to promote and improve human health and also provide access to health care. Now, according to the United Nations, there's been an increase in associated risk factors such as being overweight or obese, and that over the past decade, diabetes prevalence has risen faster in low and middle income countries than in high income countries. Diabetes is a major cause of kidney failure, heart attacks, strokes, and also a healthy diet, though, and physical activity can prevent or delay type 2 diabetes. Now, in addition, diabetes can be treated and its consequences avoided or delayed with medication, regular screening and treatment for complications. And this has over the years led to growing calls for unhealthy food warning labels to be enforced by government so that the population can actually know which foods threaten our health. Nzama Mbalati is the head of the Healthy Living Alliance, and he joins us now for more. Nzama, thanks so much for your time and welcome to Morning Live.
Good morning, Sakina, and morning to the viewers.
Let's first start by just hearing a little bit more about the Healthy Living Alliance and what exactly it is that you do.
So the Healthy Living Alliance, HELA in acronym, we are advocating for equitable access for affordable and nutritious food for all in South Africa. And I think maybe in the beginning, Sakina, let's welcome the announcement by the president coming from the ANC, NEC, which we think is important in terms of the package of alleviation of poverty, but also supporting South Africans on the cost of living, particularly on the zero VAT rating on food items, expansion on that. I would think it's a welcome relief for most South Africans to access food in general and healthy food in particular.
Now, looking at World Diabetes Day and talk about diabetes, if you look at just the sheer numbers, we're talking about across the world over 350 million people. But in those, about 90%, we are told, are type 2 diabetes sufferers. Can we draw a distinction just for those who may not yet know the difference between type 1 and type 2 diabetes, first and foremost?
Yes, certainly, Sakina. So type 1 diabetes, I mean, we are seeing the trend and changes, and the National Department of Health has been talking amongst these that, even type 1 these days, they are seeing a lot more. This was the kind of diabetes that was actually linked to, hereditary, history in the family with someone who had diabetes before. So people in that bloodline or in that family might have a risk, a precursor of having diabetes as well, as something that you inherit or it's in your genes. But then type 2 was the kind of like what people will term lifestyle. Really not always about lifestyle, but it's someone who might have body inactivity, consuming a lot of unhealthy food. It has to do with the environment and the food and the lives they live, that they get pre-exposed to obesity and diabetes. But I think the National Department of Health is cautioning us that actually now type 1 and type 2 seem to be very much linked to what we would call a lifestyle, or what we are terming, the environment and how we actually consume unhealthy food, but also how we actually having a lot of body inactivity amongst the population.
And I think that brings us, Nzama, to your call and the link between diabetes and your call for government to enforce warning labels on food items. So what are some of the foods that we should be careful about when it comes to diabetes?
So certainly very much packaged food. So packaged food, the biggest problem with the packaged food is that it comes with a lot of vigorous industrial processing. So most of the plant and food based and meat based or animal based foods, you cannot now identify. So you can start from your breakfast cereal. That's a plant based, that crunchy yellow, brown thing. You can't tell. So that it has gone through a lot of vigorous processing so that it can have a long shelf life and it can be cheaper, and palatable. So, things like your yogurt and things, but we mostly thought they are healthy in our breakfast, lunch and dinner. So there is a lot of sugar and salt and fat threshold in the packaged food. And one of the things why we are calling for these labels is two things. The reformulation that is needed in terms of reducing the threshold of salt, sugar and fat when there is a mandatory regulation is important because the producers of food don't want their food to be demonized with these labels, with these warning labels. But I think, secondly, at the first glance, it's important to empower South Africans to know, what is in their food, because currently the food we're eating, we do not know what are its ingredients, because the back of the pack now is so difficult to comprehend. It's incomprehensible for people who haven't studied food and the amount of time it takes for you when you're buying food or in a retail store. So it's very important that as part of fixing the health system, there is a mandatory regulation of the food environment. So the bread we're eating now has less salt because government introduced a salt mandatory regulation in 2016. So it's very, very important that, it's rare for the food industry to voluntarily, regulate itself. It's important that government has progressive measures to protect the consumer's health.
Well, Nzama, we have to leave it there for today, but I'm sure, this is a discussion that we need to have at a little more length, or maybe one of the other shows, the health show with Dr. Musa Mtombeni maybe can pick up on this. But thanks so much for speaking to us very briefly this morning. Nzama Mbalati, head of the Healthy Living Alliance, as we are today commemorating World Diabetes Day.